everybody. Hello, hello, hello. Welcome to Sheen Talk. I am your host, Kendell Lenice, Transformational Life Coach and author. I'm so excited to be your host today for this very informative show. We're going to be talking to Dr. Pernell today, and she is all about health equity. Hi, everybody. Can you hear me? I just want to make sure. If you can hear me, let me know you can hear me. I want to make sure my AirPods are okay. If you can hear me, just give me a thumbs up so I know you can hear me. Hello, hello, hello. Give me a thumbs up if you can hear me. You can hear me? Okay. I just wanted to make sure. Okay, perfect. Hi, everybody. I am Kendell Lenice. While we're waiting for our guests, you can follow me at Kendell Lenice. I'm going to go ahead and post that. How's everybody doing? It's going to be an informative conversation. If you're thinking about getting the vaccine, if you're thinking about, I'm just trying to make sure I have her. All right. I'm looking for my guests. I'm trying to make sure. Hi, beautiful people. How are you? Oh, I am well. Thank you for asking. Let me know what state you are in. Let me know. Where are you? Hello. We're waiting for Dr. Pernell, and I'm going to pin her, because you've seen her on CNN and you'll see her with me right here on Sheen Talk. So let me just make sure I have her right. Let me just pin her Instagram. I love it. The Good Doctor MD. And then the host is me. Hi, everybody. Oh, I see her right there. Okay, perfect. She's right there. I just want to pin her information. I see you, Dr. Chris.
Hello, beautiful.
How are you?
I am well. How are you?
I'm good. A full day, but I'm good. Good to be on with you.
Yes, I'm glad to have you in a full day with purpose. That's the beautiful thing. And I just must say, just from woman to woman, Black woman to Black woman, I'm so proud of you. I'm so proud.
Thank you.
You're welcome to hear your voice. And, you're talking about COVID, and it's near and dear to your heart, which we'll talk about. But I'm just so proud of how passionate and eloquent you're speaking, and you're going around giving this message. And I think it's so very important to hear this message from you.
Definitely. I appreciate that.
You're welcome. It means so much, because I'm trying to tell you, you already know, we're going to talk about the health disparities, but you already know how skeptical we are. And I have so much to talk to you about. We're going to talk about the Tuskegee experiment and Henrietta Lacks, and just a lot of different things that have Black folks nervous. But before we get into that, everyone, welcome to Sheen Talk. I am your host, Kendell Lenice, and I am with Dr. Pernell. And she is going to talk about the health disparities. She is a health equity officer and, of course, a doctor, and she's passionate about the pandemic and the health disparities for Black and Brown people. So we're going to talk about that and a whole lot more. So have your friends come on over to see the good doctor.
Yes.
Right.
Let's have a good conversation tonight.
Yes, absolutely. And before we get started, I love Dr. Chris. She's a genius. Oh, it's the good doctor.
Thank you.
It's so important to get your COVID-19 vaccine. So we have
Agree.
people already knowing what you're going to talk about. So that's amazing. All right. So I just really want to just really extend my condolences to you first and
Thank you.
foremost. You're welcome. Your father, passed of COVID-19, and your sister is still trying to manage her way
Yes.
through it. Can you just talk a little bit about that, and that will give
Sure.
people some insight on why you're so passionate, being a doctor, a medical doctor, and then COVID-19 and a pandemic, and why, professionally and personally it affects you. So can you just talk about, and you talk about as much as you want to talk
Sure, I don't
about
mind.
your,
Mhm.
okay, good, because
No, definitely.
I don't want to.
Yeah, I think it's important to talk about it, right? I
Yeah.
think it's important for people to hear the lived experiences, to hear the narratives of those of us who have lived this through the loss of a loved one, those of us who have lived this because either we've directly been infected or we experienced coronavirus, or those of us in the front line, whether that's in the healthcare front line or the essential worker front line. And I tell people the epidemic, the pandemic, I should say, the pandemic, the epicenter of the pandemic last spring was New York and New Jersey, right? The first coronavirus diagnosis in the United States was January 20th, 2020. That was the first laboratory confirmed diagnosis. From January 20th, 2020 through to March, our world was turned upside down. And then that epicenter landed on me and my family personally. Almost a year ago now, I lost my father on April 13th, 2020. And it really was like a war. And I say that because here I am working in one hospital and my father is sick in another hospital 4 miles away. And at that point, I wasn't allowed to go upstairs to see him. Visitor restrictions were in at all healthcare facilities, and I could only rely on whatever I could hear directly in his voice. And it was a difficult challenge communicating with the care team because they were caring for so many sick patients at a time where there was so little that we knew about coronavirus. So I lost my heroic father. My father was a character. We called him Big Tim. And he was a man who overcame the Jim Crow South. And he was a man who believed in science, who believed in Black excellence, who believed in Black power, and raised me in that. And so to have his story quieted on earth, I'll just leave it that way, due to that pandemic, it was surreal. It was painful. It was frustrating, but my family, we've clung together. And the week that we had the virtual services for my father is the same week that my sister got diagnosed with coronavirus. So it's like we were taking double blows. We had just lost our precious loved one. And then my oldest sister, who is a breast cancer survivor, who had endured a mastectomy and radiation, had endured chemotherapy. The reason why I cut all my hair off in solidarity to support her, she got infected, and she was an essential worker working in a large retail chain and didn't have adequate access to PPE, personal protective equipment, and got sick. And the next 10 months of her life were never the same. And she has clawed her way back to some semblance of her baseline and finally returning to work, but still experiencing residual symptoms. So I want people to know that that time was a time of upheaval. That time was a time of uncertainty. It was by my faith, my belief in Yahweh, my family, and my sense of purpose that I got up every day. I went to the hospital every day. I fought through the issues that we were dealing with our own patient populations, fought through the issues we were dealing with our own staff, while trying to love on my father virtually, while trying to get whatever information I could. And the last thing I'll say about it, just two key poignant things I want people to really understand when I say it was like a war. My father started to get very, very sick the week leading into his death. My dad got diagnosed, and probably within 3 weeks, he was gone. My father was in the hospital for something else. He didn't go in the hospital for coronavirus. He got exposed in the hospital. And so, he started to slow down. He wasn't eating much. And I had been checking on him as frequently as I could. And I remember checking social media and seeing another dear friend and colleague, whose father in a hospital. Yes, he died in a bathroom. And when she said that, it was like a shock to my heart. And I said, let me check on my dad. And so I called again, and his nurse, and this is the fog of war, you heard it in her voice, in frankly a disconnected way, said, oh, he's not doing well. And I'm like, he's not doing well? No one called me. What's going on? And so my dad started to get sicker and sicker across that Sunday night. You know, she was like, he's going to die. And I knew what she was describing because I'm a physician. And then we lost him by the next day. I raced over to his hospital. And as soon as I got to the parking garage and I turned the ignition off in my car, I got the phone call that my dad had died. So it's like,
oh my God,
having that experience, right? And then not being able to celebrate him in his home going like we thought we would, that was tough. That was tough. And then if you just multiply that across the nation, so many other American families, at this point more than 550,000, but so many American families had that similar experience that I did, because you couldn't be with your loved one. And then having funerals, there were so many restrictions. About 4 or 5 of us were allowed in a funeral home to see my father before we had to close the casket and then have a virtual service. So this is not how I imagined celebrating his homegoing. But he left me with such jewels, with such pearls, with such a legacy, and really a fire in my belly. And I fueled that passion, and seeing what my sister was going through. And I said, I have to find a way to be a part of the solution. So in addition to working in healthcare, in addition to helping to run a hospital and fighting for staff and for patients to be as well as they could, I decided to enroll in a coronavirus vaccine trial, because that was my way of demonstrating accountability and paying his legacy forward.
Wow, you said a mouthful there. And you know, you have some people on here saying, wow, your strength is so inspiring. My cousin had COVID-19 and survived, but very sick. You know, there are a lot of families, like you said, that are dealing with this, you know, or coping, or trying to live through, you know, whether they've survived COVID-19 or whether they've lost, you know, a loved one to COVID-19. So you have people who are on every part of this. They know someone who's had it, a family member's passed away, they've had it, you know. So to say all that, saying that it's affecting, you know, many of us, and they're saying, hearing this gives me strength. Wow, Dr. Chris. And how beautiful is it, you know, that you talked about your dad loving science and him saying, you know, to you, quoted, follow the science, and and you already being a doctor and seeing in how it's affecting folks, and already Black and brown people, you know, that's your mission. But to really, like you said, he put that fuel in you, that fire in you, to say, you know what, now I even got to go harder. You know, I understand personally, what this is like and what this does to families. And as you just said, this is not how we saw us, you know, sending our father home. And many people feel that way, with 5 people at the funeral. And you know, he passed away right in the beginning. Well, we know,
right in
like
the
you
beginning,
said, January,
right
but in
in
the
the
beginning, there was no, you know, wiggle room. It was 5
no wiggle
people,
room.
that's it. Right. So, and your sister, my prayers out to your sister, and, you know, to keep fighting, and fighting the good fight, because you are fighting that good fight for your sister and for everyone. And your boots are on the ground. You know what I mean? And it's so important that you're fighting for Black and brown people. You know, have you always fought for us in this fashion? Was health disparities and health equity important to you before this? And how has it, if I don't know the answer already, but how has it amped up your fight?
Right. Great question, right? So you can imagine, if you hear the passion and the love of life in my voice. I've been an energetic little girl for a long time that blossomed into this woman. But I knew early on that I wanted to be a physician. And the way that I had characterized it when I was in the 6th grade, I will never forget it. I went to Elmwood Grammar School, East Orange, New Jersey. Shout out to EO. I will always love and be proud to be from East Orange, New
Yes,
Jersey.
yes.
Nurtured and cradled and loved and cultivated
I'm
me.
in Maryland now, but I'm a Jersey girl too, so I appreciate you.
Okay, okay. And so, I grew up in a household, and I was cultivated in a city and at a time where it was impressed upon me that I could do anything. And a son of the South, and having fought through Jim Crow, my father having been at the March on Washington, my father having met Malcolm X on a brownstone in New York. I got a lot of my fighting spirit from my dad, and my dad didn't go to college. So my dad started at Bell Labs cutting grass because that was the job that he could get. My father went from cutting grass to being a member of technical staff. So imagine a man who is self-taught, right? Imagine a man who doesn't go to college but is self-taught. And this man raises you. And then imagine my mom. Mom had a PhD in love, and my mom affirmed me in ways that were just deep.
Wait, we can't ignore that. I love that.
PhD in love.
In love.
Yes.
I love that.
And Merlene could love like nobody else could.
When you said that, I felt that. Like I
felt
it when you said that.
And I lost my mom before I lost my dad. My mom died to severe Parkinson's. So, I was cultivated and nurtured in this environment to, Chris, you have a voice. My mother would say to me when I was little, go first, Chris, go first. And I didn't know what she was doing at the time, but as my father was teaching me excellence and a love of science, and how to advocate and agitate for Black justice, Black excellence, my mother was teaching me the power of my voice. My mother was teaching me agency. And so as I morphed along and matured through my medical training, I started out wanting to be a brain surgeon, but ultimately I realized that I had different gifts, I had different talents, I had different skills that I would be leaving on the table had I been a neurosurgeon, because it was going to require a different focus from me. So I switched into public health. And switching into public health, I was driven by issues of civil rights, issues of human rights, by issues of health equity, health justice, if you will, and racial justice. So I have been advocating for worker empowerment, health equity in communities, advocating for Black and brown communities more wholly to have access to those social determinants of health that determine, your well-being and your life opportunities. I've been doing that. And then this pandemic struck. And so what this pandemic did was crystallize it even more so that, and wasn't necessarily true for me, but it crystallized it for others, that this is not an academic exercise. Equity is not an academic exercise. Equity and justice is heart work. I tell people this all the time. I treat systems. I treat the systems that either predispose, influence, shape, encourage someone to be healthy, or I dismantle and disrupt systems that are barriers to people achieving health. So this pandemic just put a finer point
Yeah.
on the issues for me, and it gave me a national platform outside of what I was already doing in my field, my body of work. And so all things work to good. I live by that scripture. And so I
Yeah.
took this grief, I took this pain, this frustration, at times this overwhelming fatigue from the weight of it, and I funneled that into how can we save more Black and brown lives in particular? How can we save more people more generally as well? And so that's what I'm doing.
Wow. I mean, I'm just read some of the comments and you're doing just that. And to look like you look is important. It's
Yes.
important for us to see you on CNN and all the other shows and podcasts that you've been on. It's so important to speak for us because oftentimes we don't have a voice or a seat at the table. You know, we're creating our own spaces and we're setting up our own tables, but in some platforms, there's still no one to represent us. So, you know, I thank you for doing that. And
thank you.
You're welcome. And everyone's saying equity and justice is hard work. Preach, Dr. Chris, our hero, today's modern day hero, Dr. Chris, preach, sister. And they're like, woo. And they say, okay, we're both beautiful. Thank you.
Thank you.
Someone said, I'm called Mother Love because I reach out to the sick and disabled, elderly, homeless to spread love and brighten their day. Good for you, Miss Pennsylvania. Keep doing what you're doing.
Keep doing that.
You know, everyone loves, you know, Mimi says, PhD in love, you know, what does this say? Mr. Transit Man says phenomenal. Congratulations, doctor. You are awesome. Two gorgeous ladies. We appreciate you, doctor, a true hero for us. So of course, I mean, as you know, nothing but love. Thank you for everything you do.
I'm appreciative of the love.
Absolutely. All right. So Black people are dying twice as much. You know, we've heard it time and time again during this pandemic. Why are so many Black people? Why are so many brown people dying? Why are so many poor people dying? Why does everyone that dies look like us, but everyone that's getting the vaccine looks like them? You know, so I really want to talk about that because the rates, you know, it breaks my heart when the pandemic first started and throughout 2020 and even now, but let's talk about 2020. You know, when we were unsure, I mean, you might have known, like you said, you kind of knew when you were experiencing that, but a lot of us who didn't know at first that the first case was in January of 2020 and then, you know, in the northern parts in New York, New Jersey, but then we're hearing that, you know, that the old administration found out in 2019 and no one knew. So everybody was scrambling around when that March 15th date came and you know, everybody was on shutdown for the 3 months and, you know, we're seeing people dying. We're seeing the numbers go up. We're seeing people sick like we've never seen them. We're like, what's going on? Everyone has to wear a mask and stay in and be safe. And it was pandemonium in this pandemic. Everyone was afraid. And then you started to see our community suffering the most. Can you talk about that, what that does to you professionally and personally when you see this? And we already know you experienced it with your dad, but when you look at the news or you hear, you know, inside talk about that, what goes through your mind when you hear that?
Fannie Lou Hamer, I'm sick and tired. Right? And so, you know, what we see in this pandemic, we actually see the collision of two pandemics, right? We see the collision of coronavirus, this fast pandemic, this novel infectious agent that rips across the globe, leaving in its wake untold destruction and devastation. And we see that collide up against systemic racism, the pandemic of racism that has been with this nation for over 400 years, that slow pandemic that has been smoldering and stealing lives. And whenever there is a crisis, it is worse in historically excluded groups, Black and brown communities, African Americans, Latinos, Latinx, Native and Indigenous populations, and Asian Americans. It is worse because of how white supremacy and racism structures opportunity. Okay, racism is a system of structuring opportunity. And so if you look at why Black people and why Latinos and why Native Americans had worse outcomes, there are some factors that continue to emerge. All right, you look at, we worked certain jobs in higher rates than other people did. Those were frontline jobs. Those were jobs that we couldn't work remotely. Those oftentimes were jobs that were in the service sector or the production sector, and they were high contact or high proximity jobs, meaning we were in close contact with other people. Those were jobs that unfortunately people didn't have very strong income protections, or jobs where they didn't have access to PPE. And why does that matter? If you have a job where you don't have income protections, you can't take the time off. You got to show up to work or you don't get paid.
Yeah.
Okay, so you have an economically vulnerable household. Or if you, like in my sister's scenario, she didn't have adequate access to PPE. And I remember having the conversations with her. Look, Kim, you just got back to work. You just got through your treatment for cancer. You have to take care of yourself. Do I need to get masks to you? Do you have a plexiglass barrier? And she was like, well, you know, they have one mask for me and I have to keep that.
See, I heard that. Let me just pause you for a moment, Dr. Chris. Just for a moment, because that frustrates the heck out of me, because I remember someone working at a grocery store and they were talking about the grocery store. And I remember this was before everyone started getting the plexiglass, which is really still a mess because it's this part and people stand over here. So it's really not even. And I remember one of the grocery stores saying to this person, we're not doing all of that. You know, you just can wear the mask. So when you say that, that just had a chill just run down my spine, because I totally understand what you're saying and what your sister was saying. And also the ignorance of us not knowing what to advocate for, or not really wanting to push the boundaries and say, I'm not coming to work unless this, and this, because like you said, we need to feed the families. We need to, you know, figure out, you know,
and that's an unfair position to be in, right? So that's an unfair position for an individual to be in, and that's why the greatest accountability is on the system, because not only would you have people in these precarious or economically vulnerable states, people then lived in homes that were either multi-generational. Those same homes were crowded and cramped. If they were exposed, they couldn't quarantine properly, or if they were sick and infected, they couldn't isolate properly. So thereby other people in their households were immediately at risk. Or you have Black and brown groups who are saddled with chronic health conditions that make sometimes the presentation of the virus worse. You could have total or multiple organ failure. It wasn't just a respiratory illness. It wasn't just a pneumonia. My cousin who I lost 2 cousins in addition to my dad. I lost 2 cousins just before the new year. And one of my cousins, you know, bless his name, Thomas Franklin Boswell Jr., he was a postal worker right here in North New Jersey. Right. And so he scoured the city trying to find a test to confirm that he actually had coronavirus, when his doctor had started off treating him like he just had an upper respiratory infection and gave him an antibiotics. So then you have issues of access to care. You have issues of access to testing. You have issues of access to quality care. You had Black people whose symptoms weren't validated or verified, and they suffered, and they had worse presentations, and they got sicker than they needed to get. And then they ultimately were hospitalized. That's why the hospitalization rate for Black and brown people are anywhere from 3 to 4 times higher. Okay, I need everybody to understand that. When you say that the death rate or the mortality rate is really anywhere from 2 to 2.4 to 2.7 times higher in those same groups, but if you break it down into age brackets, if you look at 45 to 54, Blacks and Latinos are 6 times more likely to die. If you look at any age, at every age, Black people are dying at a rate equivalent to white people who are more than a decade older than them. So it's the accumulation of social and clinical risk factors that we've had to endure that made this pandemic worse for us. So when I say it's put a fire in my belly, we can longer have conversations around equity from a dispassionate place. We can no longer have conversations about equity from, like I said, an academic place, as an academic exercise.
Wow.
We have to lead with equity and justice and not just react with equity and justice.
Lead with equity and justice, not just react. I love that. And being proactive and getting in front of it. You know, people
Yes.
are just like the truth. Wow. You know, we have some ignorant comments and we're not giving them any power over here. Dr. Chris knows her facts. Wow, sad statistics, real talk. Exactly. And I'm going to use Miss Pennsylvania's comment because this is what I wanted to talk about next. So she says, don't be afraid to get the COVID-19 vaccinations. Vaccinations have been around for a long time. Polio, mumps, rubella, yellow fever, etc., affected people until vaccines were developed for them. So I want to talk about a great comment. The dangers of COVID-19 are real, you know, target, you know, exactly, and leave those other foolishness. Speak, Doc. Okay, so let's just talk about it. I mentioned earlier that, you know, and I'm in Maryland now. I've been here for 20 plus years. And I'm outside of Baltimore, maybe 30 minutes, Baltimore County. So when I first moved here 20 plus years ago, Henrietta Lacks, who I didn't know about before, I think I learned about her less than 30 years ago, right? And then of course everyone's heard of the Tuskegee experiment and Agent Orange. I mean, we can go on and on and on about the different things and what they said that they did for Black people. Well, I can tell you here, Dr. Chris, you still have people here that they're afraid to walk past Johns Hopkins because they feel like they're going to be snatched. Yeah,
body
they feel like they're going to be snatched up.
Body snatchers. I heard it all the time when I was there.
Right. And people still feel that way to this day. And for those listening that don't know, you know, definitely do your research. But a lot of Black folks were, like she said, body snatchers taken off the street to be tested. And you guys know Johns Hopkins is a research hospital. So those people are deathly afraid of hospitals or getting vaccines, or because of Henrietta Lacks and them using, you know, her and the experiment. So what would you tell that person who is deathly afraid of getting vaccinations? They're not sure. It hasn't been out long enough. What are they putting in my body? What's going to happen to me? Am I going to be worse than I was before? You're an advocate, and you even sat through the trial period to get yours. What's the simplest way you would tell someone that they need the vaccine?
Definitely. There are several ways that I've had this conversation, and where I usually always start is I want to make sure that our people, Black and brown people, understand what's at stake. I'm not here to convince anyone, but I am here to help people along their decision journey, right? Because it's a journey. It's a journey. And one, I want to start by validating the fears and the concerns. Why you would hear things in the Baltimore community like body snatchers is because academic medicine, clinical research has failed to demonstrate trustworthiness at the level and consistency and the authenticity that they need to. Too often, science has been a tool of white supremacy, right? So if you can point to examples in your own family's life, look, I've had a nurse call security on me. Once I was with my sister in a hospital while my sister was sick from her breast cancer. She had a blood clot in her lung, and I was asking questions. The nurse said something that didn't quite add up for me. I'm a physician. She knew I was a physician. I was like, hey, can you check her chart? Because that doesn't, I know
she knew you were a physician, and she
knew I was a physician. And I saw she started to get upset because I was asking her questions. And I said, look, ma'am, I'm tired. It's been a long day. I just came in from New York. I said, I'm not trying to like threaten you, outsmart you. I just want to take care of my sister. And she's like, oh, you want to be threatening? And I was like, whoa, why is this going left? She's like, I'm going to call security. And so immediately, you know, I'm an advocate, right? So I stand up and
there are Karens in the hospital.
Right. And I told security, it says, you're not going to touch me. I said,
Wow.
this is the implicit bias that I teach my students about, because I was a professor at NYU at the time. I said, this is the implicit bias that I teach my students about, and I'm not going anywhere until I can make sure my sister is okay, especially in a place where the nurse called security on me. It's interactions like that. It's that. It's that explicit bias, those episodes of racism that we have accumulated in our experiences, whether inside of healthcare or outside of healthcare.
And that's why people are afraid to advocate for themselves.
Right, and that's why as a learned response, as a learned behavior, blacks and browns say, or like, I need to protect myself, is this legitimate? Right? So it is the responsibility of those of us in public health, those of us in healthcare, to be able to acknowledge and own our past, to be able to acknowledge and own where we fall short. And that's usually where I start this conversation with people. I say, look, I get it. I understand why you have questions. I understand why you have fears, why you have concerns. Now let me go through point by point to explain, because I have those same fears and concerns, why this experience has not been tainted. What people usually don't know around the coronavirus vaccines is that while it appears like this, like poof, hatched out of nowhere, that's not true. Scientists were working in the lab around mRNA vaccines, not this particular mRNA vaccine, but mRNA vaccines more generally. And there were successive and cumulative breakthroughs over the past decade that gave scientists credible tools and knowledge upon which, when this current pandemic struck, they could come out of the gate running, and they had an idea of how to attack it. Two, scientists had been also working on and understanding the Sars outbreak and the MERS outbreak. You may recall those outbreaks that in the past about 10 years or so. Coronavirus, or SARS-CoV-2, is like SARS and like MERS. Scientists understood how to attack those two viruses. Knowing that, the knowledge scientists had around mRNA vaccines and the knowledge that they had around viruses, the family of, they married that information. And the technology is a game changer. And this is what I want Black people to understand, brown people to understand. We have to understand this science, because if we can understand this science, we can advocate for uses of this science in diseases that are killing our people. Okay, this science is going to revolutionize therapeutics and revolutionize vaccines, because it's a genetic recipe. I tell people, I've heard people describe it as a Snapchat message, as a blueprint. It's a genetic recipe, because it's not like a traditional vaccine, meaning that you had to grow the viral proteins in the lab. That's not what happened. It's not like a traditional vaccine where you had to grow it in an egg, a chicken egg. That's not what this science is. Basically, when scientists in China sequenced the amino acids of coronavirus, and in particular sequenced the code of the spike protein, that's how the coronavirus gets inside of the cell. It has that spike protein all around it. When scientists did that in a lab in China and then shared that globally, that allowed our scientists, and I want to shout out Dr. Kizzmekia Corbett, a Black woman scientist at the NIH, leading things and holding it down, okay? Her team, knowing the advances that had been made previously, took that information, and her team designed the mRNA vaccines and designed the sequence that it's actually been used across all three that are currently approved, that has led to these groundbreaking revolutionary vaccines. So this technology didn't hatch overnight. It's been building, but by the very nature of it, all you need to do is to design a genetic code. That happened in a matter of like 3 to 4 days. They designed the genetic code. Once they design the genetic code, you're able to then do these large-scale trials like I participated in, and I participated in the phase 3 trial. Another thing that's unusual, you normally don't get 30,000 people to participate in a vaccine trial. I was one of the 30,000 for Moderna. There were 43,000 and 44,000 for J&J and Pfizer. That is unheard of. The federal government, through a public-private partnership, made money available. So the drug companies, in particular Moderna, took advantage of this. Drug companies could do exactly that, have very large trials. What's the benefit of a very large trial? That means it has to be tested in a very diverse population, people like myself. 10% of those who participated in these trials were Black and African American. That's not usually a statistic that we approach. It's usually an equity. It's usually far lower. In some of these trials, you had anywhere from 13 to 20% to 26% Latino participants, okay? Around 5% Asian participants. You had people who had comorbidities, chronic health conditions. I'm one of them, okay? I have postural orthostatic tachycardia. I live off of pills. I take 5 pills every day. I live off of pills and faith, okay? And so you had people in these trials who had medical conditions because you would have to be able to prove it was safe for people with different conditions.
That's what I wanted to ask you. That's what I wanted to ask you with pre-existing conditions. See that, and I'm glad that you said that, because that's what I want to ask. So diabetes, cancer, like any other pre-existing conditions you can still?
Yes, let me put it to you this way. When the FDA reviewed the data and gave it the emergency use authorization, the next step is for the CDC to say, are there specific populations or specific age groups that this vaccine should be used in? And are there specific populations or age groups that the vaccine should not be used in?
Yes.
Okay? So what the CDC did not list one particular group and say, you should not take this vaccine, other than anyone who had a known allergic reaction to ingredients in the vaccine. That's the only group that is 100% contraindicated. Otherwise, the CDC said the benefits of being vaccinated far outweigh any risk associated with anything unknown that never was evidenced or surfaced through the trials. Because when you have that many people, that's 30,000 plus 43,000 plus 40,000. You're talking about over 100,000 people who went through these trials, and no one died from the vaccine.
So you're
no
saying,
one had worsening health conditions from the vaccine.
Okay, I just want to be clear what you're saying. So you're saying that whatever you can get from the vaccine is far more less than what you can get without the vaccine. Can you hear me?
No, now I can hear you now. You went away.
So you were saying what you can get, or the side effects from the vaccine, totally are less than what you can get if you're not vaccinated. So whatever else is out there, what you get, it doesn't even compare.
It doesn't compare. It doesn't compare. And let me say this.
Stress that. Yeah, I wanted to stress that, because, you know, that's why I'm so glad you're on, and I'm so glad that you are speaking everywhere, so we can hear this and we can understand, and we feel like we have somebody we can trust. You know, the information coming from you, you know, people on here, and before you, I just don't want to ignore, the best option is always to get vaccinated to protect yourself. I'm glad Sheen Magazine did this, because people like me are stuck and worried about what to do. You know, I've even gone back and forth. My daughter has gotten it. She's gotten her first one. My husband has, like, they're just recently, you know, getting it. Yes, because my daughter, my grandma from, you know, Laos sent over. Let me just go through. So everybody is thankful that you're saying this, because there are a lot of people who've gotten it, but a lot of people who are afraid. So I just want you to keep going.
Definitely.
But
yeah, and there's just something really important I want to say to people.
Absolutely.
The amount of evidence that we have in support of the vaccines, for me as a physician, as a public health physician, is overwhelming. It's overwhelming. And I don't think most persons in the public understand that. The amount of science and data that we have is overwhelming. And let me say these 2 points why it's overwhelming. One, when those trials produce results, and Pfizer was out the gate first with their results, then Moderna quickly, and they were able to demonstrate, and it would then go through peer review, and the FDA had its career scientists review it, and then other groups looked at it, independent advisory bodies. And the efficacy, meaning the ability to prevent severe disease or death, 94.5 and 95%, that's unheard of. I don't think people in the public understand how unheard of. That's why the scientific community is blown away by the science, the technology. Like, finally, we found something that was so specific, because it's a genetic code, something so specific that can attack this virus, this infectious agent in such a way that the level of protection it provides you, it's so significant. The CDC had originally, established a benchmark. It had to be at least a 50% efficacy. All of these vaccines blew by that. And that's what I want people to understand. If you look across the decades and decades of vaccine research, typically, if you're going to have a side effect, a worrisome side effect, or a serious adverse event from a vaccine, it's going to happen in the first 6 weeks of administration. That's why the CDC that's why the FDA has required 2 months of safety data before approving any of these vaccines. So the public
someone is asking, are there any long-term side effects?
Right. So and that question is very good. It's a very legitimate question. So at this point, the most that we've had, if you participated in the early phases, I participated in the late phase clinical phase 3 trials. So I got vaccinated my first dose August 31st, my second dose October 2nd. I didn't realize I had the vaccine because they don't tell you what you've received until January.
Did you get Moderna? Did you get
I got Moderna.
Okay, is that the best one? What about Pfizer?
They're all the same. There isn't one that's better than the other, and I want people to understand that too.
Okay.
But
because
when we look back, no, people are saying that. Yeah, people are saying that. When
one
we
is
look
better
back,
than the other. Okay.
Yeah, when we look back at the early phase participants, at this point, we're coming up on a year. So there's a lot that we're going to be learning. And even data was released today. What we know, not only do these vaccines all prevent death, all of them are 100% effective at preventing death. Okay, all of them are overwhelmingly, it's very technically the same at preventing hospitalization or very severe outcomes from coronavirus. We now also know, because of data released across these last few days, and the science is going to continue to build and accumulate and evolve, these vaccines are also effective at preventing infection. You know how you can be infected and not have symptoms? These vaccines work against that. And what we know is that there hasn't been, in those who have been vaccinated prior to myself, so if you do the math, November, December, January, February, March, April, I'm going on 6 months, right? So you have people vaccinated even before me. So we're coming up on a 1 year mark for those in the early phase, and we're able to study those people, and we haven't seen any data, any evidence to suggest that there are going to be any negative long-term effects. All we know with definity and certainty right now are the short-term side effects, and side effects are normal. Side effects are routine. Does not mean you're infected with coronavirus, because there is no coronavirus in the vaccine.
And that's wait, Dr. Chris. I want
go back on that.
Yes, go back, because so many people are saying that the vaccine gives you the coronavirus. And
does not.
Someone asked here, and then you can just go for it. She says, my aunt had an allergic reaction. She cannot get the second shot. So I want you to talk about the vaccine.
I'll talk about both.
Not giving you, okay, go.
So the vaccines do not cause coronavirus because they don't contain coronavirus. You can't be infected with something that's not inside, okay? The mRNA vaccines contain a genetic instruction sheet made in a lab that says, you know how people go out and buy a fake pocketbook? So in a lab, you got a fake spike protein. Because basically the scientists know the sequence of the real thing. So they're fooling the body. They're telling the body, I'm going to give you the sequence of a spike protein, which can't infect you. But the body is going to say, this isn't here normally. So the body's going to build antibodies, and the body's going to build helper T cells, right? Then the body's going to get rid of the mRNA vaccine, get rid of the spike proteins. And if the real thing comes around, the body already knows how to knock it out. So mRNA vaccines, nor does the J&J vaccine, none of them contain coronavirus. They contain genetic instructions for protein. So you're not getting sick with coronavirus when you get side effects.
I'm so glad you're saying this.
Yes. When you get side effects, it is your immune system The inflammatory process that is responsible for your immune reaction, that's what you're experiencing. And that feels like a flu to people. That's why now people will finally understand when you get the flu vaccine and people say, oh, the flu vaccine gave me the flu. No, it didn't. The flu vaccine triggered an immune response in your body and gave you muscle ache, gave you fever, gave you chill, gave you tiredness, gave you pain. Those are the same symptoms you get from coronavirus, because those are the symptoms of an inflammatory process happening in the body. And so I think it's very important for people to know that. Another thing I hear frequently, these vaccines do not change or alter your DNA. They do not. These vaccines do not impact your fertility. And you say, how are you able to say that, Dr. Chris? Because I understand the science, and that's why I want to break down the science for other people. The mRNA vaccine.
We need 2 hours with you.
Yes, the mRNA vaccine wraps in a lipid, because otherwise they break apart really. They're finicky. They break apart. So that you put them in a lipid to give them some type of structure and integrity, goes into your lymph cells, gets inside of your cells, gets into the sticky cytoplasm of the cells, and the mRNA gets read. And when it gets read, it says produces the protein, you get the immune response, and then all the stuff that you don't need, the body degrades. Same thing with J&J, only difference is J&J is a double-stranded DNA code, right? And J&J is inside of a vector. So the vector is a mutated, altered, weakened cold virus, which can't infect you, but is just used to hold it. The genetic code for the protein goes into your cells, your DNA reads it, then it gets converted into mRNA and says, oh, this mRNA says make protein, makes the protein, evokes an immune response. So those side effects that you are getting are usually short term. Those side effects are those things that I just described. And when people have allergic reactions, which are different, when people have allergic reactions, the allergic reactions have been rare, but when people have allergic reactions, everyone has recovered. If you have an allergic reaction
so
within
can they recover
4 hours,
in the second part, or they would
right,
have
that's
to
what I'm
start
explaining
all
to
over?
people. That's what I'm explaining. If you have an allergic reaction, meaning you develop symptoms of hives, swelling, wheezing, a rash, you have your throat feels really tight, your lips swell. If that happens to you within 4 hours of receiving the dose, you cannot get the second dose, okay? It's a safety precaution. You already have protection because you got the vaccine inside of you. And we now know that one dose could give you protection anywhere from the mid-50s to the 90s. So you have some protection, but you can't get the second dose. It's not worth the risk. If you get an allergic reaction that occurs 24 hours later, 3 days later, 7 days later, you can get the second shot.
So let me just clarify. Just clarify, because I want everyone to hear this. So if it's within the 4 hours of getting the shot, you cannot get it again. But if it's after 24 hours after, and so on and so on and so on, you can still get the second shot.
Yes, because that's called delayed hypersensitivity, and it's harmless. It's harmless. It's just that certain people have these allergic reactions. But the main point that I want to emphasize, the worst type of allergic reaction you can have is the anaphylaxis, when it feels like your throat is closing. That was so rare. That was like, if you looked at the first 1 million doses that were administered, you're only talking about a handful of people who got that. And no one had anaphylaxis and died. Everyone who had anaphylaxis was treated with an EpiPen and they got better.
So were they hypersensitive to certain things, or they already had they were
to the ingredients in the vaccine. Some people think for the mRNA vaccines, it's what we call the polyethylene glycol coating. So we think that could be driving some of the allergic reactions, or it's a salt component that's in there. There are sugar components that are in there, but there's no eggs in there. I've had people ask about that.
What I'm asking is this someone who may have experienced allergic reactions to other things, and now this is another thing,
not necessarily.
Or this could be brand new?
No. Yes, not necessarily. Because you could have If you've had an allergic reaction to food, if you've had an allergic reaction to pollen, dust, if you've had an allergic reaction to other metals, it doesn't necessarily dictate that you're going to have an allergic reaction to what's in these particular vaccines.
Okay.
I've had 2 family members who both have severe, who both have severe allergies, 1 to peanuts, 2 to shrimp. All 3 tolerated this with no problem.
Okay.
I have a woman who reached out to me who has actually had allergic reactions to metal and needles, tolerated the J&J with no problem. That's why we're like, if there's an ingredient in this and you're a person who has these weird allergic reactions and you know about it, don't get it. Or if you get it and within 4 hours you develop any type of allergic symptoms, don't get the second one.
Gotcha. We have like 3 minutes left because there's another interview after you. But will you be willing to come back at another time to talk?
Sure.
Okay.
Sure.
Because there's so many questions and I have so many questions. Our viewers have so many questions. They're like, please have her back.
I'll come back. Look, this is a dialogue. This is a dialogue. This is how we ensure that our people get the information that they need so they can make the choices and the decisions that they need to make. And the last thing I really want to emphasize is that Black people are not in the definitely no category. Right now, the groups or the populations that we're more concerned around are Republicans, white men, and evangelical Christians, because they are in those definitely no categories. And we need everyone to feel comfortable getting the vaccine so we can get to community immunity. What we find happening in Black and brown groups, we want information. And the more you're able to give Black and brown groups information and give it to them, it has to be from somebody they trust. It has to be somebody who can break it down in a plain way, and it has to make sense. When we make it make sense and they understand, look, you take a greater risk being infected with coronavirus. Either it could kill you because you have a higher risk of dying because you're Black, or you could have a long-term lingering side effects like my sister, or you could be a person who gets it and passes it on to a loved one who has those outcomes. Those experiences are higher in risk than you getting the vaccine and you having a very rare allergic reaction or something happening that no other scientist has seen yet. It doesn't compare, and that's what I need my people to understand. What the polling data is showing, even in the most recent polls that came out, Black people are moving. Black people are moving from wait and see to, okay, I'll get it. And you see that picking up. That's why we have to focus on vaccine equity. We gotta make sure we're getting these vaccines into those hard-hit communities.
Dr. Chris, I have so many questions. There's so many things I want to ask.
I'll come back.
Definitely come back because someone else is coming on after you, but I just want to read this quickly. And if you could just 30 seconds, just answer this.
Okay.
She said, family members are fear mongers, believing the lies of vaccines that they will kill you in 5 years. But the vaccine does not debilitate your immune system.
No, it does not. It does not.
Okay.
What we actually know, vaccines produce a stronger immune response than natural infection. Doesn't weaken your immune system.
Okay. This Troy, I agree. He said paramount information. I mean, Dr. Chris, I'm going to schedule something maybe next week. Our people will reach out to you to see if you want to come back and we can finish this conversation, because let me tell you, sis, you are doing the work. And your dad is proud of you, no doubt.
Thank you. Thank you. I feel it. I feel him.
His
I feel him.
Was not in vain, because I'm listening to you. People are listening to you that don't listen to people, right? Because you hear, the doctors, no matter how professional, no matter the educational level, whatever, they're not listening to them, because they don't look like them. And it's so important that you look like us and you're explaining this the way that you're explaining this. That's why I wanted you to do most of the talking, because it really is about this information to everyone, and everyone's asking to save it. I'll definitely save this live. But Dr. Chris Pernell, everybody, make sure you follow her. She is on a tour to save lives. That's what she's doing. Yes, I
am.
I love that. I appreciate you for sure.
I appreciate you, my sister.
You're welcome, and God bless you on this journey, and anything that I can do or personally and Sheen can do, we're definitely there to give you whatever you need to push this further.
Thank you. We're in this together. We're going to get through it together.
Yes, we are.
Okay.
And I ask because, you know, my viewers don't know and you don't know, I'm a colon cancer survivor.
Amen. Amen.
So I wanted to know if I could get it, but we'll talk. You know, we'll
you can.
talk later.
I just had a conversation with an oncologist, strongly recommending people with past cancer histories and present cancer histories to get vaccinated. So my sister, breast cancer, has been vaccinated, and I have a friend with lymphoma vaccinated. Strongly encourage it. Okay.
Because I'm still in recovery right now. I'm sitting on this seat, but I just had my surgery like last week. So, you know, I appreciate you, and I'm so
I
honored
appreciate
that
you.
they asked me to speak with you. But until next time, we'll have our people reach out to
Keep
you
fighting.
And we'll do this again. Thank you so much.
Keep fighting. Okay. Good night, everybody.
Good night.
Blessings.